Hello, welcome. Today, we're diving into a topic that affects people of all ages and backgrounds. Let's talk about joint pain, something almost everyone experiences at some point in their lives, whether it's a dull ache or a sharp twinge. Joints are the places where two or more bones meet, like your knees, elbows, shoulders, and knuckles. They're what let us move, bend, and twist with ease. These are complex structures made up of bones, cartilage, ligaments, and tendons. Cartilage cushions the ends of your bones, while synovial fluid acts like oil, keeping everything moving smoothly and reducing friction. But sometimes, these joints can hurt, making even simple movements uncomfortable or difficult. Joint pain, also called arthralgia, can range from mild soreness to severe throbbing pain. It might be constant, or it could come and go depending on your activity or the time of day. Often, joint pain is accompanied by stiffness, swelling, or even a feeling of warmth. These symptoms can make everyday tasks, like opening a jar or climbing stairs, much harder than they should be. Pain is your body's alarm system, letting you know that something isn't right. It could be caused by inflammation, an injury, overuse, or damage to the cartilage or tissues around the joint. The type, location, and intensity of your pain can offer important clues about what's going on inside your body and help your doctor figure out the cause. Remember, joint pain is a symptom, not a disease itself. It's your body's way of telling you to pay attention and maybe seek advice or treatment if it doesn't go away. Persistent pain can really impact your quality of life, making it harder to do the things you love or even handle daily routines. Understanding how your joints work and what can go wrong is the first step to managing pain, protecting your mobility, and staying active for years to come. What causes joint pain? It's a question that troubles millions of people every day, regardless of age or lifestyle. Joint pain can strike suddenly or develop gradually, and understanding the reasons behind it is the first step toward relief. Injuries are a big one. Think sprains, strains, or even fractures from sports or accidents. These can happen to anyone, from athletes pushing their limits to someone slipping on a wet floor at home. Sometimes, even a minor injury can lead to lingering discomfort if not treated properly. Inflammation is another major culprit, often linked to arthritis, a term for over 100 conditions causing joint inflammation. Arthritis can make everyday tasks difficult, and its symptoms often worsen with age or overuse. Sometimes, the immune system mistakenly attacks healthy joint tissue, leading to chronic pain and swelling. This is common in autoimmune diseases, where the body's defense system turns against itself, making joints stiff and sore. Infections can also target joints, causing septic arthritis, a medical emergency marked by severe pain, swelling, and fever. Quick treatment is crucial to prevent lasting damage. Other health conditions like lupus or psoriasis can cause joint pain too. These diseases often come with other symptoms such as skin rashes or fatigue, making diagnosis more complex. Even the flu can make your joints ache. When your body fights off infections, inflammation can spread to the joints, causing temporary pain and stiffness. Overuse injuries, like bursitis or tendinitis, result from repeating the same motion. These are common in people with physically demanding jobs or those who play sports regularly, and can lead to chronic pain if ignored. The causes range from simple injuries to complex diseases. Sometimes, more than one factor is at play, making it important to look at the bigger picture. Knowing the source helps you decide when to rest, treat, or seek medical help. Early intervention can make a big difference in recovery and long-term joint health. Always listen to your body's signals. If joint pain persists or worsens, don't hesitate to consult a healthcare professional for guidance and support. Joint pain is a common problem that can affect people of all ages, but it's especially challenging for older adults. Let's look at two main types of long-term joint pain: osteoarthritis and rheumatoid arthritis. Understanding the differences between these conditions is important for getting the right treatment and support. Osteoarthritis is the wear and tear type. Cartilage wears down over time, causing bones to rub together. This leads to joints becoming stiff, sore, and sometimes swollen, especially after physical activity or a long day on your feet. Everyday movements like walking, climbing stairs, or even opening jars can become difficult. Osteoarthritis is most common in the knees, hips, hands, and spine. The risk increases as we age, but previous joint injuries or carrying extra weight can also make it more likely. Genetics and repetitive stress on joints from certain jobs or sports can play a role too. Rheumatoid arthritis is different. It's an autoimmune disease, which means the immune system mistakenly attacks the lining of the joints. This causes ongoing inflammation, swelling, pain, and sometimes even joint deformity if left untreated. Unlike osteoarthritis, RA often affects both sides of the body at the same time, such as both wrists or both feet. It can strike younger adults, not just seniors, and may develop suddenly or gradually over time. Symptoms of RA include prolonged morning stiffness that can last an hour or more, ongoing fatigue, and sometimes a low-grade fever. These symptoms can make daily life challenging and unpredictable. RA can also affect other organs in the body, not just the joints. It may impact the heart, lungs, or eyes, so it's important to monitor your overall health. Both osteoarthritis and rheumatoid arthritis need proper diagnosis and ongoing management to protect your joints and maintain your quality of life. Working closely with your healthcare provider is key. Early treatment and lifestyle changes can make a big difference, helping you stay active and reduce pain for years to come. Most joint pain is mild, but some signs mean you should see a doctor right away. Sudden severe pain, swelling, or inability to move a joint, especially without injury, could signal infection or gout. If you have joint pain with fever, chills, rash, or unexplained weight loss, get checked. These could be signs of a serious condition. Hot, red, or dramatically swollen joints are red flags. Don't ignore persistent pain. Early diagnosis can prevent long-term damage. Caring for your joints starts with simple habits. Balance rest and gentle activity. Rest inflamed joints, but don't stop moving altogether. Low-impact exercises like swimming, cycling, or yoga keep joints flexible and muscles strong. Maintaining a healthy weight reduces stress on your knees, hips, and ankles. Every extra pound adds pressure to your joints, so even small weight loss helps. Practice good posture and body mechanics. Sit with support, lift with your legs, and use larger joints to carry loads. Stretch regularly to maintain flexibility and reduce stiffness. Listen to your body. If something hurts, modify or pause the activity. Small changes add up to big benefits for joint health. Consistency is key. Joint pain is common, but you don't have to face it alone. Always consult a healthcare professional for persistent or severe pain. Self-diagnosing can delay proper care. Everyone's situation is unique, so get advice tailored to you. Taking charge of your health by learning, asking questions, and working with your doctor leads to better outcomes. Treat your body kindly with movement, good food, and rest. Caring for your joints means protecting your freedom to move and enjoy life. Stay proactive, stay positive, and stay well.